Good morning. In the year 2008, archaeologists uncovered two 9,000-year-old skeletons. There is no definitive way of knowing what killed these ancient people. But we do know that their bones were infected by an all too familiar bacterium. The DNA was sufficiently well preserved for molecular typing to be carried out, and with analysis of high performance liquid chromatography provided direct confirmatory evidence of Mycobacterium tuberculosis. The ancient Greeks knew its consumptive effects as cysis. The Indians knew it as Chaki-onke, and the English called it tuberculosis. Today, tuberculosis or TB is one of the most infectious killers, causing more death than malaria or HIV/AIDS. But what exactly is this disease and how has this pathogen persisted for so long? Dear all, I'm Vinod Kumar, and today we, Press Information Bureau, in association with National Tuberculosis Research Institute, Bangalore, Ministry of Health and Family Welfare, Government of India, presents before you this live session on TB, its effects, treatment, its future, and how, as a country, we are successfully tackling it. I would like to welcome Director General PIB, Sri Manish Desai, to give his opening remarks. Over to you, sir.
Thank you, Vinod. Respected panelists of this webinar, Dr. Ravichandra and Dr. Somsekhar. 24th March, as you all know, is the World Tuberculosis Day. And ahead of this important event, the Western Region Media Units of the Ministry of Information and Broadcasting, that's PIB Mumbai and Goa, Regional Outreach Bureau Pune, have joined hands to organize this webinar to do our bit to create awareness about tuberculosis. The mandate of INB media units, as you know, is to effectively communicate about the policies and programs of Government of India. And they include the entire gamut of subjects, be it economic affairs, social sector policies, education, science and technology, etc., etc. Among these, health communication has also become an important aspect. Ever since the outbreak of COVID-19 in early 2000, health communication has assumed greater importance. Although COVID-19 remained the focus area, government's focus on overall health communication has now received a fresh impetus. You must be knowing that, there were briefings, the national briefings taking place from the National Media Center every single day during the COVID pandemic. And thereafter, we have been holding regular briefings on COVID and the precautions to be taken every day, every week. Over the period of 2 years, our INB media units, especially in the Western region, have been organizing a number of health-related webinars and workshops. In the process, we have also learned a lot, interacting with subject experts like you people, fine-tuning our communication strategy on continuous basis. Today, the focus of our webinar is on a major health hazard, but an entirely curable disease of tuberculosis. The only condition being the patient should patiently complete the entire course of treatment prescribed by the doctors. Our experts on the panel, who are well versed with Government of India's National Tuberculosis Control Program, will explain these things in detail over the next 1 hour time, as I am not the subject expert. But we do play a small role, but an important role of being the communicators. Let me tell you, drawing a good communication strategy for TB is not an easy task. First and foremost, there's a need to address the perception challenge. There's a need to communicate about symptoms and treatment. There's need to reassure family members of the affected persons. And most importantly, there's a need to address the issue of stigma. Being an airborne disease, TB can infect anybody, practically anybody. Raja ko bhi, praja ko bhi. In this regard, celebrity endorsement, most importantly by the Bollywood icon Mr. Amitabh Bachchan, has attempted to address these challenges quite effectively. India has been using a combination of mass media and interpersonal communication for effective TB control. As you know, in terms of mass media, apart from the press communication which the Press Information Bureau does, the Doordarshan and All India Radio, apart from the private television channels, We have got a specialized institution of Regional Outreach Bureau, which specializes in interpersonal communication. And we have effectively used a combination of both mass media and interpersonal communication, particularly communicating about the tuberculosis control program. But this has to be a continuous process. As mentioned by my colleague Vinod Kumar, the World Tuberculosis Day is observed on March 24th, the day the German physician Robert Koch announced the discovery of TB bacillus bacteria that caused the dreaded disease. Koch's discovery opened the way towards diagnosing and curing tuberculosis effectively. Further drug developments, introduction of multi-drug treatment have made this disease entirely curable. The theme this year is Invest to End TB, Save Lives. This is very significant. By the way, World Tuberculosis Day is one of the 11 global health campaigns of the World Health Organization. So it has got a worldwide focus. Most of the developed countries have since overcome the problem of TB with greater awareness, health investment, and better standards of hygiene. It is the lower middle income and underdeveloped countries that are still struggling to overcome the disease. India is a signatory to the UN Sustainable Development Goals, SDGs, which envisages making the world tuberculosis free by 2030. But India's National Tuberculosis Control Program, the revised strategy drawn up, it has drawn up a strategy to achieve this target before the deadline, say by 2025. In this regard, Swachh Bharat Mission is also playing a major role in controlling the spread of many diseases, not just tuberculosis. The country has indeed made some rapid strides in control of TB, but due to COVID-19 pandemic, there are reports of some setbacks or some reverses being witnessed, which need to be addressed on urgent footing. Achievement of the goal to eradicate TB by 2025 will only be possible if we adopt a comprehensive approach to ending TB, including a shift towards gender sensitive and gender specific interventions. So now it has become doubly important to invest to end TB and save lives. Thank you.
Thank you, sir. Now we have with us eminent panelists from National Tuberculosis Research Institute. I would like to welcome to them to this webinar. We have with us Dr. Ravichandra, Chief Medical Officer, National Tuberculosis Research Institute, Bangalore. He's an alumni of Mysore Medical College and has done postgraduate training in internal medicine. He has 2 decades of experience in practice of clinical medicine. He's working in the capacity of Divisional Head Human Resource Development at NTA for the past 8 years. He is an author and co-author of various research papers published in national and international journals. We have also with us Dr. Somashekar, Director of NTI. He is a pulmonologist and a public health specialist involved in implementation of National Tuberculosis Elimination Program in Hassan District in Karnataka. He is also a facilitator and a master trainer at NTI, contributed for the capacity building of district, national, and international TB control program. He is also a member of National Technical Expert Group, National Tuberculosis Elimination Program. He has contributed to the review and scientific publications in national and international journals. I welcome both of you to this webinar. First
Thank you.
question. First question, let me ask to Dr. Devichandra. Doctor, what is this TB and what is the burden of TB in India?
Sir, TB is an infectious disease which commonly affects the lungs. That doesn't mean that it doesn't affect the other organs. It affects mostly lungs, more than 85% of the cases, and it causes cough. And it is an infectious disease, so the cough of the patient who is throwing out droplets will be infecting others also. So this disease destroys the lungs, and if the patient is not on treatment, there is a possibility of fatal outcome in the patient. So it is caused by a bacteria, Mycobacterium tuberculosis.
Can you please enlighten us what is the burden of TB in India, how grave the situation is in India, and how we are successfully tackling it?
So incidence of TB all over the world, it is quite high, around 10 lakhs. whereas more than 26% of these TB cases are happening in India. So one fourth of the total burden of TB is being suffered by Indian population. So uh, the MDR-TB also, HIV-TB cases also. So quite a high burden of TB is in India. So for example, the MDR-TB cases, uh, if it is around 5 lakhs, 1.26 lakh MDR cases are there every year in India only. Yeah.
Okay. Next question to you again, sir. What are the symptoms of pulmonary TB?
Uh, they will have cough. That is the most common symptom. Coughing will be there, weight loss will be there, loss of appetite. Sometimes the patient may say chest pain. Then the patient will be tired, so they will have a feeling of illness. So loss of weight will be there. It can be very significant. A cough of more than 2 weeks, and fever usually will be there in the night. It is probably because the person is not aware during his active day life, because the fever is low fever. So in the night he will be aware, and sometimes the patient may also experience sweating. These sweatings are not normal sweatings. Though the others are feeling cold, the patient will feel drenching sweats. Sometimes the patient may have to change the clothes, change the bed sheet. So much of drenching um, sweating may be there. It is not compulsory. Some of the HIV TB patients will have it commonly, or extrapulmonary TB cases. That means the patient who is not having, or who is having disease both in lungs as well as the other organs of the body. So they may experience these uh, sweats. And these patients may also complain of blood in the sputum. So that will be an alerting, and patient will be afraid. So they will come with the history of blood in the sputum, thinking that it is cancer. So these are all possibilities. One has to rule out TB first, and uh, these are the symptoms. Yeah. Sir, I think you have to unmute yourself, Mr. Vinod.
What you described is symptoms of pulmonary TB. I understand that there are certain other kinds of TB which affects different organs of the body. Does the symptoms are same for all kind of TB, or is it different?
There are two types of symptoms. One is general symptoms and organ specific symptoms. If the patient is suffering from whatever the TB, they will have these general symptoms of loss of weight, loss of appetite, evening rise of temperature, and so patient will lose weight. So these are all general symptoms, they will remain. And the other types of symptoms are the organ specific. If the patient, most commonly they suffer from lung disease, then they will have the cough, sputum containing blood, not always, sometimes, but cough will be there. And if the person is suffering from TB affecting any of the bones, they will have pain in the bones. And if it is a lymph node TB, there will be a swelling. A patient may be aware, may not be aware. So these are all possibilities. And if the patient is having brain or meningeal TB, we say, so they will have the symptoms related to these. They'll have headache, there'll be the alertness will come down, patient will be in stupor like condition. So these are all
Okay.
symptoms which is
Yes, yes,
related
doctor.
to the organs.
To expand on this, I would like to ask the same question to Dr. Somashekar, Director of NTI. Which are the other places in the body besides the lungs that TB can significantly affect, and how fatal it can be? Can you please give an explanation?
Again, Dr. Somshekar is.
The just we have to understand that TB can affect any organ in the body other than the nails and the hair. Wherever the RBCs goes, wherever the blood goes, everywhere it can affect. So it doesn't spare any organ in the body. An example, as Dr. Ravichandra has told, that pulmonary TB is the most common. You already mentioned that. That is the most commonest symptom is chest pain, cough. Cough is for more than 2 weeks. That we have to understand. Anybody is having cough for more than 2 weeks, we have to rule out tuberculosis. Other extrapulmonary tuberculosis, the most common is lymph node tuberculosis, where we see that most commonly it affects the young adolescent girls. But anybody can be affected. Neck swelling, they used to come with the neck swelling. So that is the one, lymph node TB. The next is pleural effusion. What I mean to say is that whatever the lung is there, no, in that there is a covering. It is called the pleura. There will be accumulation of the fluid. So there is a when there is a accumulation of that is the next common, where in that case what we will get is there is a chest pain, breathlessness, uh, all those things will get that. The other commonest, other least common, not commonest, extrapulmonary tuberculosis are, it may be a skin TB, it may be ophthalmic, that is high TB, it may be Dr. Ravichandra has explained TB meningitis. That is the most serious forms of tuberculosis is tuberculous meningitis. That is TB, central nervous system, involvement of central nervous system. And then that is a one, all over the lung, all over the body can be affected. That is called miliary tuberculosis. These are the two serious forms of tuberculosis: is TB meningitis and then the miliary tuberculosis. Cardia, as it was mentioned, it was shown there. There is what I meant to say is there is a pericardium. There also it can accumulate. The water can be accumulated there. It can put a pressure on that. And GI system, it may affect the intestines, or it can affect the bones also. Dr. Chandra has already mentioned. Uh, so any organ, kidney, genital, the most common cause of infertility in our country, where there is a childless is tuberculosis. That we have to rule out tuberculosis, then only we have to go for other causes. So among infertility, where there is a childless couples are there, TB is the most common.
disease.
Vinod, could you please repeat? Your mic was muted that time.
Doctor, this question is for Dr. Ravichandra. What's the difference between TB infection and TB disease?
Yeah, this is an interesting topic. Actually, in surgical wards, the medical students, whenever they say wound is infected, see, it is actually not infected. They will have symptoms. That is, disease will be there. In TB, we have two distinct things. That is TB infection. TB infection is there in 1/3 of the world's population. That doesn't mean that 1/3 of the world's population is suffering from TB. They have infection inside. In the same way, in India, more than 40% of the individuals are already carrying TB bacteria in their body. That doesn't mean that they have any symptom. They may not suffer from TB disease throughout their life. And among the infected, there is a possibility of around 10% breaking down to disease. So this may happen due to various reasons. Most common, and what we have identified, is when the immunity is low because of HIV, diabetes, stress, or the lung is damaged, smokers, general health condition is low like alcoholics, or there are so many other conditions where the person is not doing well in his life. Anytime in his life before his death, there is a possibility that the TB may break down into disease. Then they will have symptoms. So what we expect around, if 100 people are infected, we say around 10 persons will break down to disease. When disease is there, that is identified by symptoms or signs. So signs are those which are identified by a doctor. So while examining, or the patient may complain of cough or pain or stupor. Patient is not complaining, relatives are complaining that the patient is not well, or some chest related things, chest pain, loss of weight. All these symptoms are there. That means the patient is suffering from TB disease. So this is the difference between infection and TB disease. But there is another aspect. If the person is having HIV, then there is a possibility that around 100 persons who are having HIV and TB, 10 persons will develop disease every year. So if the person is not on treatment, maybe by 60 to 70% will become diseased in their expected lifetime of around 7 years or 8 years or 10 years maximum. without treatment. So diabetes also increases the possibility of infection becoming disease. Around 30% of them, there is a possibility in their lifetime suffer from TB disease if the TB diabetes is not controlled well. In the same way, there are other diseases also which increases the possibility of person suffering from TB.
Okay, okay, Doctor. Thank you. That means that a good majority of people have been infected with TB, a latent phase of TB, and they have not developed into full-blown TB. Just like, is it comparable to HIV and AIDS, where you get infected with the HIV virus and develop into AIDS later, or can a person go along without getting a full-blown TB at later time?
It is possibly not fully comparable because a person who is affected by HIV, there is less chances of he remaining without any symptoms throughout his life. So the latent phase is very, very less. As compared to TB, there is a very high possibility. 90% of those who are infected will never suffer from TB disease. Yeah, unless they are having a comorbid condition like HIV or diabetes. If the person is suffering from diabetes, of course, that increases the possibility to around 30%. And if HIV is there, 7 to 10% will suffer from TB. Whereas in HIV, most of those who are infected will develop HIV disease. They will not remain HIV infected. That's the difference between HIV and TB.
Okay, 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 Doctor. Thank you, thank you. Dear audience, Selman Abraham Waxman, biochemist and microbiologist whose research into the decomposition of organisms that live in the soil enabled the discovery of streptomycin in the late 1940s. You can see his picture here. This is the edition of the Time magazine in November 7th, 1949. So from that era started the proper treatment of TB, which evaded humanity for quite some time. Dr. Somashekar, can you please elaborate to us how this TB disease is treated and is it fully curable?
Am I audible now? Yeah. TB
Yes.
disease is treated by, there are two types of drugs are there, first line drugs and second line drugs. First line drugs are, as you already mentioned, that streptomycin is the drug as cells Waxman was invented. After that, INH, rifampicin, pyrazinamide. These are the drugs which has been given to treat the TB. As I mentioned that in the TB, there are drug-resistant TB and drug-sensitive TB. For drug-sensitive TB, the duration of treatment is 6 months. That INH, rifampicin, pyrazinamide, ethambutol we will be giving for first 2 months, and another 4 months it will be INH, rifampicin, ethambutol. However, for drug-resistant TB, it varies from 9 months to 11 months for H monopoly, and for other shorter oral bedaquiline and longer oral bedaquiline, the duration will be extended up to 18 to 20 months. As I mentioned, for drug sensitive TB, it is usually 6 months. However, in spinal tuberculosis and meningeal tuberculosis, it can go up to 1 year or sometimes 1.5 years. So the drugs are not given to the patient actually, because as you know that any chronic disease, when you take medications till the symptoms subside, then only we will take. After that we will not continue. So what happens, first initial 2 months patient consumes the drugs. When the symptoms goes down, they will not take. So the drugs will be given under supervision. It is called DOTS, dots therapy. Strategy is dots, directly under supervised therapy. Some patient centric approach, what I mean to say is, we call as a dot provider earlier, a treatment supporter. We were nearby, acceptable, accessible to the patient. We will keep the drugs. Every day the patient has to go there and consume the drugs. And then as it was shown in the slides also, for new case regimen, the drug resistant TB, second month and 6 months sputum examination will be done, but every month patient has to go to the doctor and show, because there is a chances of adverse effects. To address that adverse effect, to identify, we have to follow up with the every month with the doctor. However, the dot providers are also were trained how to go about that. In a sense, they will refer the patient to the nearest medical officer. Whether it is treatable, 100% cure, yes, if the patient takes the right drugs, right duration, without any interruption. If there is an interruption, there is always a chance that failure will happen. The patients also can die. So you have to remember that you should not default. You have to take everyday drugs without any interruption for the right duration.
Doctor, not many diseases needs this very long duration of treatment. This therapy is, as you mentioned, it's around 9 months. Why is it that this particular strain of bacteria needs a treatment for such a long time?
Okay, just I want to give an example. For example, a typhoid bacilli, which is causing enteric fever, is causing the best bacteria will divide within minutes. However, this within 10 to 14 days will get the disease. Within 14 days, if you take the medications, that's enough. But the characteristics of this beautiful and dangerous bacilli is it divides 18 to 24 once in 18 to 24 hours. And to get the disease, today I got infected. To get the disease, it takes around 6 months. It may be 60 years also. So the disease is slowly progressing and divides very slow. And to get the disease also, from infection to disease also, it is longer. And that is the reason it requires longer therapy. However, within 2 months, the culture and the smear may be negative. But whatever it happens, there is a latent bacilli. You are telling about that earlier also. In that latent bacilli, there is always a chance that metabolically inactive, they will not consume the drugs. They will, like Kumbhakarna, they will be sleeping. We don't know when it is going to get up. So if drugs levels are not maintained, what happens? Whenever the Kumbhakarna gets up and eats, so there is a recurrence. The more chances of relapse, more chances of failure will be there if you don't consume the drugs for a longer period. This is the basis. And other thing is, to get a complete cure, the 6 months therapy is the minimum duration. I'm telling you, minimum duration. It may extend also. So metabolically active drugs maintenance is very important. So initially we give 4 drugs, then 3 drugs. And adverse effects also, initially it will be more. Later on, once the patient takes the drugs, it comes down. Actually, we have to reassure.
Thank you, Doctor. Uh, a message to our audience.
Small intervention to make.
Yes.
Uh, Dr. Somsekhar just mentioned about a long duration treatment. He said that 6 months is a minimum duration of treatment. That kind of a long treatment naturally will put a question in the back of a mind of a patient. May not be a well-off patient. That how do we meet the medical expenditure for such a long duration treatment? Would you like to say something about and what the government has got in this regard? What kind of help from the government it can be available? That is for the general audience. I think that will be
Sure,
helpful, Dr.
sure.
Shekhar.
Sir, very good question you asked. Each and every drug diagnosis is free of cost, especially in public sector. So patient need not spend a pie for that actually. In fact, to promote and to reduce the adverse effect, Government of India is giving 500 rupees those who are registered and notified TB cases every month till the treatment duration. Every month 500 direct benefit transfer will be there. Once they have to give the account number. So in advance, why this money is given is, as you know that most of the patients are very poor patients, they cannot afford. The thing is, the high protein diet, if you give good diet, adverse drug reactions will come down. To take care of that, to complete the treatment, Government of India is providing 500 rupees. It may be 2 years also. Not only that, for treatment supporters also, we will be providing an incentives. What about that public sector I told? What about the private sector? Whether the patient is diagnosed in the private sector or public sector, the treatment and the whatever the benefits are same for them also. If the patient is not ready to come to the public sector, in the private sector itself they can take a treatment. Only thing is under supervision. Everything is under supervision. They have to complete the treatment. Not only that, even private doctors or in nursing homes, there also they will be given incentives as a honorarium. It is not as a fees and other things. The consultation fees and other things, whatever the private doctors charges, they have to give. But for the other treatment and whenever there is some difficult diagnosis also, the Government of India will pay for that. Not only that, if there is surgery, admissions, Ayushman Bharat, PMJY, they can be linked to that.
So
Okay.
basically, to reassure people that cost cost of treatment is not a hurdle or a challenge in this, and people should avail the government's facilities and come forward to take
Sure,
treatment. That's right.
sure, sir, sure. Yes,
Yeah.
sir,
Thank you very
absolutely.
much.
Thank you.
Thank you, Doctor. A message to our audience. You can post your queries on the YouTube live chat that you are seeing now, and it will be answered live by our expert panel members. Next question is again to Dr. Somashekar. Once a person completes the treatment for TB disease and he is cured, can he or she get TB again?
Yes, there is always a chance that around 10 to 12% of the patients, it is called relapsed TB or recurrent TB. It can recur. That is the reason, as I mentioned actually in the previous slide, after treatment also, after 6 months of treatment, every 6 months up to 2 years, the patient will be post-treatment follow-up. We call it as a post-treatment follow-up. Every 6 months, we do follow-up. Every 6 months, patient has to go to the doctor, and whether symptoms are there or not, they have to go. Suppose in between, if there is a reappearance of symptoms, they need not wait 6 months or 12 months only scheduled visit we have to go. Immediately they should approach, but all will not get the relapse. Only a few patients will get the relapse. Positive thing is there is 90%, 85 to 90%, they will not get, they will be cured. But they should remember that, as you mentioned, that a caution, it can relapse or recur also depending upon the risk also, because smokers, alcohol, after taking the treatment, oh, now my treatment is over, I will start smoking and drinking, so there is always a high chance. And those who are diabetic, what they will do if it is uncontrolled, there is always a chance. So these are the people that will get a chance the recurrence. And undernutrition also one of the major this one that we get that.
Okay, doctor. Thank you. Thank you.
But that is also, once again, sorry, I want to reassure once again that relapse TB also curable. You should not bother that, but you should keep it in mind that it can relapse. That is also curable.
Okay, okay. Dr. Ravichandra, what are the dietary restrictions that has to be put in place, or what are the specific set of diet that you have to consume while undergoing the treatment for TB?
Actually, there is no special diet prescribed for TB treatment. During treatment, whatever nutritious one can afford, the patient is advised to take. There are some superstitions which say that you have to take non-vegetarian food, you have to take beef. All that is unscientific, not at all recommended. If culturally is not acceptable, don't take non-veg. If it is acceptable, please take egg. If it is acceptable, because egg gives a very high proteinaceous food. Even if you don't take egg, if you are taking all other nutritious food that is available at home, you will get cured. But there is a importance that you have to take your tummy full. When you are on treatment, you will have more appetite, so patient will start they will become more energetic, they will start getting hunger, and loss of appetite symptom will go away, and they start gaining weight. At that time, no compromise, have full tummy, full food, take all types of vegetables, green leafy vegetables, then you will gain good weight. There is no special diet prescribed, so no worry about taking any special food for TB treatment. The only special thing that you have to take without miss is full treatment course of drugs. That is very important. Along with it, of course, a full stomach.
Okay, okay, doctor. Now the next question is to director. It's a very specific question, doctor. What's the relation between HIV, human immunovirus, and tuberculosis? In the modern times, these two terms are very radically intertwined.
It's a deadly combination. What I mean to say is, Dr. Ravichandra has already explained. Whenever there is HIV, the immunity goes down. TB is also like that. Those who are infected with the TB, if there is a HIV, the chances of getting breakdown of the TB infection to disease is up to the tune of 70%. In their lifetime, every year, whatever the annual risk, what we say that. However, the only thing is when there is that is the reason. See, for all others, whenever the patients comes with the symptoms, then only we ask them and we do the diagnosis and we prefer for the laboratory investigation, chest X-ray. However, HIV, it is intensified case finding. Every month when the patient goes to take ART drugs, that is antiretroviral drugs, HIV drugs, the doctor will ask the patient, do you have any symptoms? 4 symptom complex. Because early diagnosis of tuberculosis is very important on that. So it is intensified case finding activity. There we do it. Because not only a TB, the other opportunistic infections are also there. And drug or other opportunistic infections also we have to take care. For that also we will give cotrimoxazole prophylaxis therapy for those who are having HIV. The other things, the benefits of early diagnosis is you can cure early also. Whether the along with the ART antiretroviral therapy, anti-TB drugs also has to be taken together. But certain antiretroviral drugs the doctor will modify it based on whatever the anti-TB drugs we are giving. So even earlier, within 5 to 10 years, the chances of patients HIV are dying more. Now we seen that up to 20 years on treatment, like it is a manageable chronic disease like diabetes and hypertension. Only thing is the most common cause of death among HIV is tuberculosis. The most common opportunistic infection among HIV is tuberculosis. Once again, it's a cause for death. So you should be very careful. You have to identify and treat tuberculosis. The HIV can be manageable.
An ancillary question to that, doctor. HIV therapy consists of highly active antiretroviral drug, and TB consists of this DOTS therapy. So this is like a cocktail of a significant number of drugs. How does a patient prepare himself to take this amount of drugs, and what are the side effects that one should be prepared to accept?
Exactly. When there are more number of drugs are there, more number of tablets are there. When they consume, it's like a mini breakfast. So what happens? So that is the reason. First, if there is, I did diagnose TB and as well as HIV together. First, we give treatment for tuberculosis. After 2 weeks only, we start antiretroviral therapy. That is HIV treatment. The reason is we don't know because the adverse effects are similar for HIV as well as for the TB. It may be vomiting, gastritis, itching, all those things. So once the anti-TB drugs are, once the patient tolerates, then only we are going to start the antiretroviral therapy. But the thing is, there is always a chance that more adverse effects will be there. These are closely monitored and also blood investigations every month, if possible, clinical examination, and they will be in touch with the online. There is a supporters will be there on telephone. And more supervision is required, but it is manageable. Only polypharmacy, yes, we do have, there is always a chance that more adverse effect, but we can manage those things by frequent monitoring.
Thank you, doctor. Thank you, doctor. Now, next question is to Dr. Devichandra. This is an important question with respect to the current times that we live in. Any connection between COVID-19 and TB? Are there any precautions to be taken, changes in treatment, or anything else to be borne in mind by patients and general citizenry in view of the emergence of COVID-19 pandemic and its potential relationship with TB?
Yeah, programmatically and disease itself, there is I mean, not much disease itself. There is not much of relation, not yet proved. Uh, See, diagnosis of TB came down drastically because of COVID-19. So fear of getting COVID-19, if the patient is visiting the hospital was there, so patients were not coming even though they have cough. Resources and manpower from TB got diverted to COVID work. So many of the TB workers, they started working for the COVID. So TB work suffered. And frequent lockdowns. Transport was not there. If the patient is suffering from TB, they are not visiting hospital, they could not visit. So this was a major impact on TB program. It has gone back from 5 to 10 years. So another important thing is cough was there, which is both common to COVID as well as TB. So people used to get confused. And if the patient is suffering from cough, they are not interested to come to the hospital because they may get isolated. So 15 days they are not there in the house. So this fear was there in all the population. They are not coming. So they kept on coughing and they kept on spreading the disease to all others in the family as well as in the society. This was a major problem. And that is the reason in the initial phase itself, Government of India issued a circular. If the patient is coming for diagnosis of TB, they have to be checking for COVID also. And those who are coming for COVID, diagnosis, they should also be given sputum for TB checking. This circular was there in the initial part of the pandemic itself. So, so these things to some extent happened, and we could do some justice, but TB suffered a lot. Many of the TB patients, they could not come, they were not diagnosed, so they died because of this problem. The Is there any possibility of interaction between the TB and COVID? So far, no evidence. The only thing that is, some curiosity is the extrapulmonary type of TB is increasing. So extrapulmonary TB, when it is increasing, uh, what is the reason? We don't know. Normally, we expect around 15 to 20% maximum. Most of the times, we have seen 18% around extrapulmonary TB as compared to the pulmonary TB. Now it started increasing. So wherever there is more COVID, more extrapulmonary TB cases. So so these are all things which are fodder for the future research. So far direct evidence is not there that there is a direct relation between these two diseases. So these are to be investigated further.
Uh, Thank you, Doctor, for letting us know the logistical issues that COVID-19 created for the screening of TB. We have learned recently that mass screenings using artificial intelligence by uploading the X-rays into an artificial intelligence software and screening it. So these are the latest technological developments. So can you briefly explain, Doctor, how this AI is used to screen TB?
See, artificial
To Dr.
intelligence
Vishnu.
is coming up in a big way. So in every sphere of our life, artificial intelligence is being used. In the same way, TB also. So around 5 to 6 districts of Karnataka also. So they have developed an app, and another app is also being developed where the X-ray image is fed into the artificial intelligence app, which will say whether the uh, patient is having a normal chest X-ray or an abnormal chest X-ray or suggestive of TB. And there are other things that are all going on. For example, CTD, there is a uh, uh, there is another experimentation that is going on where the sound of the cough is being analyzed by the computer or artificial intelligence to know whether this cough is similar to a TB cough. So by seeing that, whether it is possible to predict TB. So these are all some of the things where artificial intelligence has uh, been helpful to medical fraternity. So experiments
Yes.
are going on.
Yes, doctor. What we understand is that even a basic device such as Raspberry Pi can be used as a endpoint node to create and upload the data into the cloud, and massive gains in computing power is taking a lot of radiologists in screening TB. So the next question is to Dr. Somashekhara. What's drug-resistant TB and who is at the maximum risk of contracting it?
Drug resistant TB is a TB where the bacteria is resistant to first line drugs. As I mentioned, to INH and rifampicin, these are the first line drugs. If the bacilli is whatever the bacteria, Mycobacterium tuberculosis is resistant to INH and rifampicin, it is called as drug resistant TB, that is multi drug resistant TB. Mono drug resistant TB is also there for INH. And XDR-TB is what I mean to say is for second line drugs. Second line drugs is whatever the drugs we are giving for multi-drug resistant tuberculosis, like levofloxacin, linezolid, and bedaquiline. Any of this plus plus any of the first group A drugs. That is, one is fluoroquinolone, that is INH and rifampicin, and fluoroquinolone. This is pre-XDR. XDR is INH, rifampicin, fluoroquinolone, or bedaquiline or linezolid. This is called XDR-TB. The most common cause is the bacteria always after certain mutations. What happens? There is always a chance that natural mutation. But for INH, it is 1 in 10 to the power of 6. For rifampicin, 1 in 10 to the power of 8. So, one bacilli to become a drug resistance, at least 10 to the power of 14 is required, but it is a very rare chances. The most common cause for drug resistance is we are responsible for that. We have created an environment for the bacteria to resist to develop a drug resistance. It may be a poor quality of the drugs, or it may be non-availability of the drugs, or it may be a wrong dosages or wrong combinations, unsupervised treatment, absence of guidelines, non-compliance, or health system is not monitoring the treatment, or there is a poor funded or poor adherence, or there may be a chance that the patient might be taking the right drugs also, but absorption is less, and there is a social stigma where the patients are not ready to go and take the consume the drugs in front of others. So there is a chances of default. So it is one is a doctor's cause, another is a patient cause. Both are responsible, and programmatic cause is also responsible. But the chances of cure among drug resistance is only up to the 50 to 60% only. Whatever we do that, because more adverse effects will be there, long duration of treatment. That is the reason the best this one is prevent drug resistance by consuming the drug 6 months, right dosages, right standard treatment, and right follow-ups. That is very important. Adherence is very important.
Okay, let's continue that discussion with the Dr. Ravichandra. What is multi-drug resistant tuberculosis, MDR-TB, and what is extensively multi-drug resistant tuberculosis, XDR-TB? Can you please explain that in detail? Doctor, your mic is on mute.
The definition of multi-drug resistant TB is the TB which is resistant to two most commonly popularly used drugs, that is rifampicin and INH. So without these drugs, you cannot cure TB. So that is the condition. So when these two drugs, they become resistant, then it is called as multi-drug resistant TB. Though we have 4 drugs, these 2 drugs are very, very important. That is your MDR, multi-drug resistant TB. What is XDR? So TB caused by a mycobacterium, which is already resistant to INH and rifampicin. That means the MDR bacilli, when they become resistant to fluoroquinolones, levofloxacin or moxifloxacin, and along with it, if they become resistant to the newer drugs like bedaquiline or linezolid, these are the 2 newer drugs, very important drugs, either of them or both of them. If they become resistant, then we call it as XDR. So it will be difficult uh, for the treating physician to cure these patients, because the bedaquiline is a new drug, a very good drug, so which has given hope for those patients who are suffering from XDR. So if that is gone, then it will be very difficult. So of course, the research is going on. The other regimens are also coming. So uh, the message is very, very clear. The practitioners who are practicing TB, sometimes there are practitioners who are practicing MDR-TB also. So they should be very careful. Never misuse the drugs which are new drugs. See, we have faced multi-drug resistant TB and we have killed many patients because we have misused rifampicin. The message is very clear. We should never misuse the drugs. The patient should get the proper dosage, proper regimen, and patients also should take all the drugs responsibly. If this program gives a very clear message for those who are suffering from TB, if the doctor says 6 months of treatment has to be taken, the patient has to take it, whatever uh, the patient is. So they have to complete the treatment. That is very, very
Yes, doctor.
important.
Yes, doctor. The therapy is 6 to 9 months long. So, what are the side effects of such a long duration of medication? Doctor Somashekara, can you please answer this question? What are the side effects of such a long duration of medication of a cocktail of drugs?
Yeah. Here, this is for a drug resistant TB. It is very, very more side effects. However, this picture, whatever we are showing, is for drug sensitive TB. The 6 months treatment duration, whatever you are told that. Any drugs, when you take for more longer period, there is always a chance that we are going to get a nausea or vomiting sensation. Actually, it is a not a nausea or a vomiting. You feel like, the reason being, when you take more drugs, we tend to consume more water, a full glass of water for one tablet. If you take more water, there is always a chance of nausea. So the best way is, when we advise, if you feel nausea and vomiting, so please take within 15 minutes with little water, one drug only. So within 15 minutes he has to consume. And the next most common is there is always a itching. The patient may develop itching. A normal antihistaminics can cure that. There is always a chance that it will go, or because of the skin dryness also the patient may develop. We ask them to use moisturizers or coconut oil, whatever it may be. So that will go most commonly. The other commonest is gastritis. Always there is a chances of gastritis. So we tell the patient to take the food and then only consume these drugs. On empty stomach, better not to take. If you can tolerate, it's okay. Otherwise, you should not. There is always a chance that what I mean to say is hearing loss. When we are giving injection, hearing loss was there. Now we have gone away with the injections. Then blurring of visions. For ethambutol tablet, there is always a chance blurring of visions. The first symptom is the green leaf looks like a red. So that is the first sign. If there is a change in color, any abnormal color, so optic neuritis, we have to meet the medical officer. They will refer to ophthalmologist. We have to stop the drugs. And some other drugs are also there where we may get a thyroid disorder. In the sense, there is thyroxine levels may go down. And for pyrazinamide, arthralgia, joint pains, this is also there. But all these side effects are going to settle within within 2 months. The patient should be assured that we assure the patient that continue taking medications unless otherwise severe, because the doctor will tell that it get adjusted, the body get adjusted initially, liver enzymes and our body get adapted to that, then he can continue. But whatever the minute side effects, please tell the doctor, he will
Okay.
guide you.
Yes, doctor. We will come back to that. Next question we'll post to Dr. C. Ravichandra. Albert Calmette and Camille Green, these were the two French scientists whose work from 1905 to 1921 developed the vaccine for TB, BCG vaccine. BCG is, of course, an abbreviation of the Bacillus Calmette-Guerin, which means Bacillus of Calmette and Guerin. First came in the year 1921. So, in this context, what is the status of TB vaccination now in our country, doctor? And how long does it take for India to completely eliminate TB?
See, elimination of TB is the vision that is envisioned by PMO. So the world was aiming at eliminating TB by 2030 and India wanted to do it by 2025. Imagine, we have 26% of the whole burden of TB in India. So it was an impossible task or a difficult to reach task. So this was envisioned by PMO, and the whole gamut and the whole department of TB got activated. Every month there used to be one new addition. Every entire thing became digitized. New strategies were developed. So all this happened after 2014. So lot of new changes happened. So we were aiming at doing this to TB so that we'll be able to end TB by 2025. Of course, in between, you all know that pandemic came, all the TB workers were diverted. So there is a difficult task to do it. Of course, the game changer is if vaccine is available, yes, vaccine will definitely help us. We have TB preventive therapy, which is going to be of great help. Now, TB preventive therapy is already started all over India, so that will be of great help. Earlier, we used to give only for those children who are less than 6 years, and now less than 5 years. Now, all the householders of the TB patients will get vaccine, TB preventive therapy. And vaccine is under development, and NTI is one of the sites among the other 12. So if the vaccine comes, then there is a possibility that there is a hope that we may be able to end TB or eliminate TB. And there are other things, like for example, all the poor nations will have malnutrition as a major cause. India main driving force is malnutrition. So there is a need to end malnutrition to end TB. That is a prerequisite, because 15 to 55 years age group, 50% of them are malnourished, and they are contributing to around 30%. Smoking contributes to around 10%. There is a need to have a solid strategy. and the indoor air pollution is causing around 12 to 18% of those TB patients. So there is a need to extend and effectively implement Ujala scheme so that every householder will get LPG gas so that indoor air pollution comes down. And diabetes, of course, diabetes is a problem, and because of diabetes, there is a chance that around 30% of all those uncontrolled diabetes patients will suffer from TB. So that has to come down, because for that diabetes has to be controlled. And of course,
Yes,
India is
yes,
becoming
doctor.
India
Doctor,
is
before we,
becoming
yeah,
diabetic
yes, doctor.
capital. Yeah,
Yes, yes.
please.
Before we move forward, we have a special guest from Goa. Welcome, Dr. Manish Gaunekar. He is the head of State TB Mission from Goa. Doctor would like to discuss a few topics with NTI. Welcome, Doctor.
Thank you very much. Thank you very much. Thank you, doctors, for a wonderful information being shared on this occasion of World TB Day. So, as we have already said that a lot of activities have been started, lot of initiatives have been started by Central TB Division all over the country to achieve TB elimination by 2025. Such as bi-directional screening for TB and COVID. Then lot of we are doing post-treatment follow-up. We are doing screening for our screening for TB. Presumptive TB examination has been scaled up. We are starting with TB preventive therapy and lot of other activities. Recently, we had sub-national certification going on all over the country. Also, we are developing AI app for cough sound recording to know for diagnosis. Also, AI for X-ray. So, with all these activities being taken up, uh, we still find that the public at large is not coming forward because of maybe because of COVID. There is some scare in their mind that they are not coming forward to get themselves examined, get themselves screened, in spite of being symptomatic. So, if you could give a message to them as to public at large, so that they are motivated and they come forward and get themselves examined. Yes, doctor.
Sir, is it a question for me or Dr. Chandra?
Yeah, Dr. Somsekara, if
Uh,
you could
Yeah,
I would
thank you,
suggest Dr.
thank you.
Devijendra may please answer it.
No, no, anybody. So, uh, very nicely highlighted the World TB Day. This one, just to yeah, Manish sir was also mentioning in the initially, the burden of tuberculosis is like this. So every minute we are three deaths are happening. Every day, 28,000 infections are happening. This is a global figure. However, when it comes to India, one third of the death is in India. How to prevent that? As already we have addressed the whatever the knowledge about tuberculosis, what the program is going on, all those things. The best message what I wanted to give is anybody who is having a cough, it may be our family members or friends, please get them checked for the tuberculosis. We have to suspect tuberculosis among them, and then it is not TB, it may not be. Maybe if you examine 10 TB suspects, one TB patient may be there, but quality diagnosis at the designated microscopy centers and the good quality of the sputum we have to take, and we have to get it tested for drug resistant TB initially itself. Earlier, after 6 months of treatment, you used to get that. Now, within in the initial part itself, we have a very wonderful NAT diagnostics like RT-PCR and whatever you used to say for the COVID. No, like that we are having a RT-PCR test like that. Gene expert is there, True NAT is there, and then culture is also there. Now, when it comes to the culture, it is only in the intermediate reference laboratories or national reference laboratory it will be there. The complete picture of the TB bacilli characteristics, if you identify, it is easy. First, understand the enemy. If you understand the enemy, you can easily kill. So this is the tool available. Understanding the enemy, we can kill it. But the thing is, with the correct diagnosis, correct duration, and correct management. And it is not only a single person, you and like me can be a part of this NTB game. Actually, each and every individual, society, community, business people, corporate sectors, not only government, in private sectors also. Unless we fight together, it is very difficult. Community awareness, community task force, uh, Dr. Manish Gaurenkar may be having a lot of interventions in his state, like that. Different states will be having involving the community. TB champions, treated TB patients also we can involve in this, so to create awareness and early diagnosis and treatment. To cut the chain of transmission, early diagnosis and prompt treatment. So that is the only tool. And for the politicians or the local PRIs, invest. Manish sir has told the World TB Day theme is invest in TB to save lives. Any program requires three things. One is money, manpower, material. Money is required to run the manpower as well as material. So all these things, unless we invest, it is difficult. We cannot save the lives. We are going to lose so
Yes,
many
yes,
deaths. Thank you.
yes, doctor. Let me come to it. Can you please explain how, as a country, we are investing in eliminating TB? What are the novel research initiatives that Government of India and especially your organization NTI is taking to eliminate TB? Let's come to the crux of our webinar today.
Yes, exactly. The funds has been four times increased. Domestic funds. Actually, we used to get the international funds and in kind and in soft loans. But in the recent, maybe 8-10 years, the domestic fund has been increased drastically. But is it sufficient? Globally, there was this one. Whatever the for the COVID vaccine, within 18 months, 100 billion has been invested. However, for the TB, it is only 117 million only. Out of the whatever the budget kept for TB, only 50% has been given to us. So, what I request the governments and other organizations or the states is, whatever the money is there, please provide to that. Don't utilize to some other this one. One of the northeastern states, we went for a supportive supervision where the TB money has been drawn to COVID, not only human resources. So TB, how we can eliminate TB or diagnose TB cases? More deaths are going to happen. See, TB kills not now. TB kills after 2 years. COVID kills now. That is the reason people think that COVID is the main killer. No, it is the TB is the killer. It is going to continue. TB kills more, so we have to invest. Our organization is mainly for training and research. We do train from frontline workers to ASHA workers to program managers, national level, international level. Sir, country consultants will come, CRO countries will come. Ours is a WHO collaborating centers. And the research is a laboratory research. We have to give quality control of the whatever the diagnostic tools I have told, from microscopy to sputum collection, microscopy to culture. We are going to do that quality assessment and quality assurance. And then Dr. Vichandra was mentioning about BCG. Vinod also mentioned BCG has been given to prevent childhood tuberculosis, deaths due to childhood tuberculosis, not the pulmonary tuberculosis. So please remember all the whatever you are hearing, all the webinar participants, at birth we have to give BCG or within 1 month. So such that among the children, TB meningitis and we can prevent TB meningitis or childhood tuberculosis like miliary tuberculosis. These are the two serious forms of TB. We can prevent that. And the next is vaccine. We are doing a vaccine trial with along with the ICMR, where this vaccine, not the BCG vaccine, this vaccine is to prevent from those who are infected to getting the disease, that we can do that. And our institute is also involved in supportive supervision. After training, we go to the field, how the program is implemented, any lacunae are there. This is called operational research. Program policies and guidelines we teach here, impart the training, and the field how it is going on, what are the lacunae we identify. This is called operation research. We are doing this type of research as well as training activities and providing laboratory
Ye-
services, quality
Yes, doctor.
assurance.
Yes, doctor. Yes, doctor. Uh, One last question from me. This is towards Dr. Ravichandra. As the head of training division, what is more head of training division of NDI? What is more required and needed to be done, especially by the citizens of India in our national fight to eliminate TB? What's your message, Doctor, to the viewers who are watching this webinar?
Yeah, let us be simple. As Dr. Somshekar already has told, so anybody who is having cough of more than 2 weeks, whether you are suffering or someone else nearby, he may not be aware. If he is having cough of more than 2 weeks, please direct them to go to a place where the testing is done. That is the most important thing. There should not be any need for the Manish sir to go and search for the patients. They should come. So that is an important thing. And if all the patients are coming to the government setup or the government recognized labs, more than 90% of the work is done. The second most important thing is all those who are started on treatment, it is a national duty to complete the whole of course of TB treatment. It is not just for saving your life. It is to save the lives of your own householders, your own relatives, and the neighbors and the Indians. Finally, it is our national duty to completely get cured of TB. And when the doctor says, please come, even after curing, every 6 months, please visit. So never get annoyed. Please come and talk to the doctor. And for 2 years, he is interested to see whether you have a recurrence of TB disease. Even one day cough, you must visit and give the sputum for testing. This is an important thing. So that will prevent, we will be able to eliminate TB very shortly.
Yes, Doctor. We have a question from one of our viewers. Mr. Riaz has asked this question. Should children or elders be excluded from school, work, or other activities if they are suffering from TB? As in, self isolation is okay or not?
No, actually, isolation is not necessary. Like already Dr. Somshekar has described, say 2 weeks of cough is already there. That means he has already infected whoever you want to infect. So there is no need for isolation. One reason. The other reason is the drugs that are given to TB treatment is the most effective. They are gems. That's why they should never be misused. So rifampicin, INH, the first line drugs that were described, they will uh, decrease the bacillary load so fast. Loads of bacilli will get killed within 3 days, and within 2 weeks, the patient will become least infective, and within 2 months, so they are almost not infective. So there is no need to isolate. The only thing is, please wear mask. So masks are already available anyway. COVID has done one good thing among all the bad things that it has done. So that has started the practice of wearing mask. When you have cough, for whatever reason, for whatever duration, please wear mask so that you are not a source of infection to the others. It may be TB, it may be COVID, whatever it is. Wear mask. When you are coughing, wear mask even inside the house so that your children are not suffering. So this is an important thing. Before diagnosis itself, you should start wearing mask, even in public places. And please stop smoking. That is an important thing. Of course, this is not the forum we are discussing TB, but it is related to TB. So smoking also increases the chance of you getting TB as well as you start coughing. And whatever the disease that you have, that you start spreading to others. So instead of spreading disease, you please spread love and compassion.
Nice of you, Doctor. Nice of you. This is now
No,
it's
thank
time
you.
to.
One second. So, doctor, I think, Vinod had done a lot of research. He asked very probing questions to you. But my question is a very general question. You observed that, the tuberculosis has now remained the problem of the lower income and the underdeveloped countries, whereas most of the developed countries, through better hygiene standards and all that, have overcome this. Remember, America, United States, United States, United Kingdom, Europe, they all had their problems in the 19th century. But now, they have almost overcome this tuberculosis problem. What is the role of public hygiene and sanitation uh, in controlling this tuberculosis, especially?
Sir, public hygiene and sanitation, not only for tuberculosis, any other health diseases, it prevents. That is always is a very, very important aspect. For spreading the TB, to control the TB, Dr. Ravichandra has mentioned cough hygiene. When you are coughing, uh, not only a mouth we have to cover, we have to cover both nostril and mouth, and we have to cough such that it should not spread in the hair. That is very, very important. As you mentioned about the developed countries, yes, when there is a developed countries, there the malnutrition is the one which is which is giving more TB cases in our country. If we increase our if we reduce our malnutrition status, certainly the immunity, for immunity the nutrition is required, our immunity automatically increases. So those coming from the malnutrition you can reduce. However, you have to remember, India is called as a capital city of diabetes, where the prevalence of diabetes is increasing. The prevalence of smoking, not only among males, you used to tell that. Now it has become a status for the females also, other gender also, they have started, they also increased. So unless we prevent these smoking cessation, alcohol abstinence, or alcohol de-addiction, the addiction programs, upgrading the malnutrition status, good nutrition. So that increases the immunity, and HIV almost that we are taking care that you should sustain. These are the things, and workplace identification, early diagnosis. These are the things that we can overcome, that we can achieve that NTB, sir.
Uh,
Rightly mentioned, sir. These are very
Yes,
important things.
yes. Something that I just remembered to add to what Manish sir had said. Strangely, in the Victorian era in Europe, this TB was called as a romantic disease, as because
John Kids.
because
John Kids. Yeah, yeah.
yeah,
John
because
Kids.
many malnourished malnourished
Beauty.
artisans, poets, especially the words of Lord Brown, if someone can scroll on the screen, is that he wished to die in conception, declaring how pale I look. I should think like to die of conception, because then the women would say, "See that poor
Beautiful.
Brown, how interesting he looks in dying." It's a Victorian way, because people thought something strangely romantic with this TV. So now it's now it's time to conclude
Yeah,
on March
just
24th.
so Vinod, because you have
Yeah.
told the romantic this one. John Keats is the one. At the age of 26, he is died. Even though
Yes. Yes.
little literature is there, each and
Uh,
everything, because he was an intern, he actually cared for the brother, mother also. He got the TB and died. And whatever the love letters he has written to the girlfriend has become, each and everything is a very important. Whatever the outcome it has been given. TB is also called as a beautifying disease. But the thing
yes.
is,
Yes.
it beautifies. Not only that, the microbiologist says TB bacilli, how they describe is a pink, curved, and slender. It's a beautification. However, wherever there is a beauty, there is a dangerous. But the thing is,
Yes. Yes.
this bacilli is not only a beautiful bacilli, it is also very intelligent bacilli, because it adapts and it eats our the drugs, whatever the poison we give, and becomes intelligent. So it is sustaining because of that only. It adapts easily. So it is very intelligent and beautiful. Whenever there is a intelligent beauty together,
Yes,
finished.
sir. Yes, sir. I remember. In fact, it was called as white plague during that era. And one thing strangely that's ironic in the case of TB is that TB, the bug TB, type tuberculosis bacillus, evolved with humans. Most of these zoonotic diseases come from bovine animals to humans. But in the case of TB, it's very special that even in the Neolithic era, about 9,000 years, and evolution traces us back as 73,000 years, that this bug evolved with humans. This bug is a byproduct of human evolution. This is what we have read. And now it's time to conclude, doctors. I would like to thank all of you for your valuable time. On March 24th, 1882, Robert Koch announced his discovery of Mycobacterium tuberculosis, the bacteria that causes TB. Dr. Koch's discovery was the most important step taken towards the control and elimination of this deadly disease. A century later, March 24 was designated as World TB Day, a day to educate public about the impact of TB around the world. Until TB is eliminated, World TB Day won't be a celebration, but it's a valuable opportunity to educate the public about the devastation caused by TB and how it can be stopped. Thank you all for the participation of this webinar. We would like to thank all of the speakers, DGPIB, and all of the viewers of this channel. Uh, Thanks and gratitude from the bottom of our heart. See you next time. Bye.
Thank you. Thank you all.
Thank you. Thank you.
Thank you.